Now, before we proceed to the closing, which is Act 3 of our call, we want to make sure that you're practicing. I want to be sure that you have the opportunity to practice all of these questions with somebody. I think it's very important that you find a partner, sit with them, and what you'd need to do is you'd need to invent a scenario where one of you is the patient, and be sure to have the typical types of things in mind. For example, have an incident in the past that you might want to think about, have a future motivating event, have some experience with going around and visiting other clinics, things like that. Have a criteria list in your mind, a priority list, and be ready to answer the questions quite clearly. And if you can role play this, you're going to be much, much closer to being able to practice it on the telephone with a level of confidence. Again, we have spent a lot of time in going through these questions, and it may feel like these calls might take 2 hours at this rate because we've spent hours actually talking about it. But in reality, again, we are only talking about 5 to 7 minutes. You can get all of this done within 5 to 7 minutes of a telephone call if you're efficient and if you're asking the right questions and not wasting any time giving superfluous detail that isn't really necessary at this stage. So I encourage you to practice. Again, I would say minimum 10 times, usually 20, ideally 50, and as many as you possibly do. Scenarios where you can use the sheet that I provide for you that you can download, and also get ready so that when patients call, you're in a position where you feel a lot more comfortable about achieving this process.